Okay, so this is a 58-year-old male that presented to the emergency room this morning at about 11:20 this morning. He came in complaining of nausea, vomiting, abdominal pain, and that was reported in the right lower quadrant. And he also had a fever of 101 upon arrival. He does have a paternal family history of appendicitis, so they worked him up for that. And he also has a fairly extensive medical history. I updated all of it in his chart, but some of the main ones is that he does have a pacemaker, which was placed in 2002 after an MI. He has history of CAD, stomach ulcers, and depression. So like I said before, he had the right lower quadrant pain, and he has a family history of appendicitis. So they did go ahead and do a CT of the abdominal pelvis, and that did confirm that he has acute appendicitis. He had labs drawn, and he did have a pretty significant white count. It was a 23.6. So like I said, his primary diagnosis is acute appendicitis. He was given 1 liter of normal saline, which was bolused, and then 600 milligrams of acetaminophen PO, which was for his fever, 20 milligrams of Zofran IV push for his nausea, and then 5 milligrams of morphine IV push for abdominal pain, which was all given when he was checked in. And he is currently on an IV drip of ceftriaxone, and that is running right now. I started about 10 minutes ago, and it's going for 30 minutes. So about 20 minutes left. The plan of care for this patient, he is going to go ahead and have surgery. He is currently waiting in R1 to be transferred up to the operating room to get his appendix removed. His surgery is scheduled for today at 4 p.m. He has consulted with the surgeon and the resident that will be working on his case, and we have obtained the informed consent. I did go ahead and make a copy of that and place an extra one in his chart, just in case anything happens during transfer. Make sure we have a copy of that on file. The patient hasn't had anything to eat or drink since last night at 8 p.m. and is currently NPO as he prepares for surgery, so he's all set with that. And his wife should be arriving here in about 10 minutes. I just talked to her on the phone and gave her the room number, so she should be here soon. Patient is ANO times 3. He's able to ambulate on his own. I just checked it on him. He reports no pain at this time. He doesn't want any more pain meds. Doesn't have any allergies, and he is laying comfortably at the bedside. That's it for this patient. Thank you for your time.